simple, but it's very important. Please attach this one to the tube holder. Yeah, always put it as tube holder before you do anything else. Yeah, connect it. Otherwise, if you know that, oh, well, it's nothing but simple, okay, fine. But this is what could, if things could happen. Okay, you kanchong and fill everything, set up everything, attach to the patient. Now, okay, now we need to hook it on the bed or whatever thing. But how to hold it? It's simple, but it's it's very useful. Okay, first thing first, basically, let's just attach the thing to the holder like this. Okay, this basically to keep it vertical and to prevent the tube from kinking. Okay. Second is basically you need to fill up this monitoring chamber with the distilled water of 20 cc. Using this type of syringe, slip tip syringe. Do not use lower lock syringe because lower syringe because it will not be able to. You're not be able to inject in it. Do not use water. Do not use a needle. That's the most important. Because you're going to damage the valve itself. This valve is similar to your IV needleless system, needleless port. So we are using similar kind of concept. Okay, so fill up with the water and just insert the nozzle into the blue bung there and just inject it. Okay, so use distilled water and try not to use saline, although there's no harm of using saline, but let's just standardize to distilled water because of when you're using saline, after a while the screen is going to be crystallized. Okay, it might irritate you in terms of seeing the bubble, but it does not affect any kind of performance, the bottle performance itself. In terms of safety issue, no problem also. Okay, although in this bottle itself is stated that use saline. Yeah, ignore the word saline here. Okay, so reason being is that in most countries sometimes the saline is cheaper than distilled water. Yeah, especially it's like it comes in 20 ml because nowadays there's this 20 ml ampule distilled water, right? So for us, we are so lucky that we can just take that one. It's nothing will go wrong lah. But some people, distilled water is more expensive than saline. So especially the ampule, so they tend to withdraw from use the either saline ampule and just injecting it. So internationally, we just standardize to saline even, and is no harm basically. If let's say you accidentally fill in with saline, just leave it, yeah, and ignore the crystal whatever thing. What you want to see is bubble, not crystal. So the crystal is not going to affect your reading, your bubbling on the bottle itself. Yeah. Okay. Next one, third is basically you need to you know that the most important part of this bottle is the one-way valve. Something like your underwater seal, right? If you don't fill up the underwater seal with water, then the air may go back to the patient side. So likewise with this one, how do I know if the valve is working correctly? Okay, so it's because it's like JCI will ask, how do you know the bottle is okay to use or not? So how to check? Like ETT, you also need to check. You need to inflate the balloon and press kind of thing, right? So what about this one? So this one, there's a way of checking the bottle itself before using. Okay, what you need to do is that pinch the tubing closer to the box itself. Okay, king, pinch. Don't just king, king and pinch. Squeeze the bulb, okay, and observe for a few seconds. If the bulb remains deflated while you're pinching hard here, means to say the valve is working correct, working fine. But if let's say after you squeeze, right, the bulb is kind of re-inflated, don't use it. But make sure you pinch correctly lah. Don't like as I was explaining to you, don't just do like that, king, king and pinch. Yeah, because otherwise I'll get a return bottle unnecessarily. Okay, king and pinch and then squeeze the bulb and observe. And this process you can also do it even when patient is using connected to bottle. Let's say for example, 1 hour later by right the patient is supposed the pneumothorax is already kind of or is getting better. But how come this patient is getting worse? Yeah, so you can also just verify it using this valve. Let's say this already connected to the patient, right? You just king, pin. Make sure that the valve is really patterned like this. Yeah, it remain deflated. Remain deflated when you squeeze it. Yeah. But if let's say you pinch when surrounding patient really like, hey, how come this one like this? Even you pinch really hard, right? So quickly change the bottle. Yeah. Because there might be something wrong with the valve. But so far never happened. Okay. So far in the past 15 years, according to them, never happened before. Okay. So but this is just to satisfy the JCI kind of a standard that you need to check the thing before you use it on the patient. You need to do the checking first. So this is the only checking that you need to do. A pinch, a king, pinch and squeeze. Okay, this is how you do it. Okay. Next one, the fourth one, is that like I think I already explained to you in terms of what are the connectors. Identifying the right connectors. By default is L, and we are provided with two sets here. To change the connectors, basically you need to change the connectors. Basically, what you need to do is hold here, push against one another, and then to unlock it, turn anti-clockwise. Yeah, so push, okay, push against one another, and just unlock, turn a little bit only, okay, and pull. Okay, this is to unlock. Okay, let's say you take the size M, let's say size M. Same thing, there's this notch and there's the groove here. You just align it properly, push and then turn clockwise. Then pull to do some kind of bit of pull test, just make sure that it's locked position. So this is how you do the thing. Okay, and I understand that currently you are doing the securing the tube with the tapes. Basically, you need to use 4 strips of tapes, right? Yeah. Counting, right?
So 1, 2,
like
3.
H, right? Yeah. Yeah, 4, right? Altogether, right? Yeah, 2 leg, right? Yeah. This one, that one is only 2 movable item.
Yeah.
But 1 chest tube and 1 tubing. This one, 3 removable connectors. Okay, 1, 2, 3. So the only thing that you need to, so basically what you need to do is that you just need to add 1 more strip, 1 more leg. 1, 2, 3, 4, 5.
Okay.
Yeah. So the long tape is here. Yeah. Okay. So make sure do not block these 2 port. Yeah, because this is the where it for sampling port and the high negative pressure relief fan. Okay. So just add 1 more tape in there. Yeah. Okay. So any question for these 4 steps? Yes.
Because you said just now do not lock. How do you know whether it's locked or not?
Oh, pull.
Okay.
Yeah. So just do a pull test. So every time you want to lock, right? Align this one, the groove, the knots and the groove. Then turn, push, and turn clockwise. Do a bit of pull.
Okay.
Yeah.
There's
So-
no clip sound or something.
Actually, there is just a feel only. But this one, my demo unit already called out already. It's been like doing this for many times already. So that's why the reason that why you need to secure here also is just to prevent people from accidentally turning the thing. Yeah. Okay. So just 1, 2, 3, and then 4, 5 here. Yeah. Okay. So yes.
Can we change the lab with the cover inside too? Because I understand it should be a sterile.
Sorry, where?
No, the cover of your.
This one?
Can we change it with this cover inside too? Or we need to remove it so that we can
But
change?
because you're going to touch this one also anyway. Yeah. This one is still as long as in the sterile area.
So we
when you're
put all
using-
in a sterile.
Yeah.
Then doctor will.
Yeah. So yeah. So let them change lah. What
Alright.
change lah. Yeah. Okay, because if you put the cover here, it's only like if confirm you're using size L lah. So you just ask them, then pass it on to the doctor, size L kind of thing. But if let's say you want to size M, if you want to change it, can also, but it's loose also lah. Yeah. Yeah.
So that one is only for
It is-
L only.
Yeah,
It's
I
only
mean
for L.
because it's the doctor who is on
Yeah.
sterile field, so they are the
Yeah.
one to supposed to change lah. We are not the one to change.
I don't know how, but some people you can also help them change with the sterile glove. It's quite simple to use. Yeah. So currently it's the doctors who's changing it.
Yeah, they are the one opening the thing.
Oh, okay.
Yeah, they also do the connection.
What about the changing of connector? Are they aware of
It
what?
depends on the size that you are using.
Okay. So because most likely they will use a lot of size M. So that's
Yeah,
why it's like
24 to 30.
oh 24 24 then L lah straight away. You're using 24 here. Okay, then L no problem. Because in some
Unless it's a small size,
Yeah.
they use 20.
20 then size M.
Yeah,
Yeah. So we just use that one. Just in case also
depends
using
on the sizes that they use.
yes. And also the pigtail also using the size M also. Yeah. Okay. Anyway, alright. Any questions so far for the first 4 steps? That is quite important to know. First, basically, it's just basically you need to connect this. Okay. Put the tube here. Second, water. Second is check the valve first. Okay. Check the valve. Okay. Third is water. Fourth is basically find the correct connector. Yeah. That's direct. By then it's already attached to the patient.
Yeah.
It's safe already. Okay. Now, what about if let's say the patient requires some suction? So, what should you do? Sorry.
We're asking how.
Yeah lah, you need to
Okay.
try.
Okay. So, for suction, basically it's very simple. Okay. Let's say, give me the numbers that usually that the doctors usually use.
20, 25.
20 lah. 20 usually quite common here. Okay. So what's most important thing that there's this white knob here, above here. Okay. And also there's a vertical line, yeah, that is pointing towards whichever number. You can see the number here. So point it at 20 first. Don't worry about where should the line be pointed at. 2 on the left at 2 or in between 2 and 0 or at the 0 side. It's okay. Just leave it there as the around 20. Okay, and then only use the thoracic suction regulator. Set it up to 30 centimeter water pressure. Fix it at 30 for all suction pressure that is below 20. Yeah, the prescribed pressure, let's say your prescribed pressure is 15, still use 30. 20, also use 30. This is just the main source only. This is where you control your suction. Yeah, something like your water. Okay, your water is like basically like your prescribed pressure, but your wall has to be higher than your prescribed pressure. Because you will need to see the bubble, right, on the suction. Same thing like that. Okay, so always fix it at 30 to make to make life easier, rather than I have to add 10, I have to add 15 kind of thing. It can be quite confusing. So just fix at 30, standard at 30 centimeter water pressure for your thoracic suction regulator. So, and then you know that this is already 20, then I pretend that this is the wall suction at 30 already. And then when make sure that the wall suction is in the off position, then you just attach this suction tubing. Actually it's already connected to the patient. Then I on it, then you observe something. The red value drops. There's a red value appearing here. And then there's also number here.
20.
Yeah? Can you see the number on the red value? What is it? Can you tell me?
20.
Is it 20 or 22 around there?
More than that.
Around 22, right? So it's not tuned, right? So how come? It's okay. Don't worry about it. So that's the only time that you need to fine tune that number. I want 20, right?
Unregulated.
So I just reduce the thing. You adjust it, now 20. Turn the knob anti-clockwise slightly. So this is your prescribed pressure, not this one. Yeah, remember just now I emphasized, don't worry where you put your arrow at 2 or in between 2 and 0 or at the 0 side. Okay, because this is like your aggregation number. When you plug it, so that when you know where to set it up, so that you know when the suction is on, it will be more or less around the area. Okay, only then you fine tune it. Now, if I want to reduce, let's say the doctor says, okay, I think I'm going to reduce to 15. What should I do? Don't touch the wall suction, just touch this one. Okay, only look at the red value. Don't look at this number. Okay, so I just turn. Let's say this is 15. Okay, you can see that the marking is at 15 here. Okay. So this is where you need to chart, not this one. Yeah, this is only for the initial placement of the pressure itself. Okay. So when patient is no longer using the suction or before the transfer, right? You need to switch it off, right? Make sure you switch off from the wall suction first before you pull out the suction tubing. Yeah. So make it a habit that before attaching or before detaching, the wall suction has to be in the off position, because otherwise there will be like jumping of the fluid here and there. Yeah. So we don't want that to happen. I think you've seen that before, right? Okay. So when that thing happens, you blow it back, then you need to change the whole bottle. Yeah. But for this one, yes, there's a possibility that jumping when especially a pleural effusion and hemothorax, this one will jumping from the first compartment of suction, from the collection compartment from here, then going to the second compartment, then the next shift has to minus plus minus kind of thing, then headache lah. So, but with this one, if let's say you topple your bottle, you don't need to change the bottle. Okay, it is still very safe to be used on patient, so you do not need to worry. The reason why the pleural effect or other wet system chest drainage bottle need to be changed immediately, because what happens is that these three bottles, right, the underwater seal, collection chamber, and the suction chamber, all are linked. So the fluid might migrate to one bottle to another. Yeah, so you do not know what the whether or not the underwater seal is still there or not, kind of thing. So better throw everything. So for this, because we are using the Chevrolet valve here, is one-way valve. So it's not going to, the fluid is not going to, there's no fluid at all. Okay, so and the fluid also will never migrate going back to the patient side. Okay, so the only thing that you encounter is that the fluid and the collection chamber might be migrating to one another. That's the only thing. Okay, so this is the setup, the 5 setup. The 5th one is basically like when the suction is required. Okay, you just need to remember the first 4 so only from here. Okay, any questions so far?